Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing about the instruments that we use in septoplasty. So I'll tell you the usual instruments that are used and we'll talk about their parts, what are the uses, and sometimes if there's any confusing other point that you need to know in relation to those instruments, I'll also tell you about them. You can also now purchase my notes. I've added links in the description. Okay, so let's get started with our first instrument. So our first instrument is a very common OPD instrument, which is the Thuticum nasal speculum. Now, Thuticum nasal speculum, this was named after Johann Ludwig Wilhelm Thuticum. And this speculum has two parts. First of all is the U-shaped handle that we are seeing over here. This is where we hold it. And this U-shaped handle has two curved blunt blades over here at right angles to this U-shaped handle. So there are two parts to the Thuticum nasal speculum. Now the next very important question that arises is, what are the uses of this Thuticum speculum? Now, before we talk about how we are using it in septoplasty, first let's discuss what are the possible uses. So, uses can be divided into two types. We have a diagnostic use, and then we have therapeutic uses. In diagnostic uses, we use it to do anterior rhinoscopy. Now, anterior rhinoscopy, here you may be asked, what are the structures that you see when you perform anterior rhinoscopy? So the structures that you see over here would be, we look at the nasal mucosa, we look at the floor of the nasal cavity, we look at the nasal septum, the lateral wall, not the whole of lateral wall. What we see over here would be the anterior end of the inferior and the middle turbinate and their metatarsus. And lastly, we look at the nasal cavity as well. A very important question here that you need to remember is, what we cannot see in anterior rhinoscopy is the nasal vestibule. Because we cannot see the nasal vestibule, it is important that before you perform an anterior rhinoscopy, you should elevate the tip of the nose to examine the nasal vestibule, because the blades of the speculum, when you're putting it in the nose to look at the to examine the nasal cavity, the blades of the speculum end up obscuring the vestibule. So anything, any ulcer or any caudal deviation or any furuncle in this region can be easily mixed. So it is important to remember, before you perform anterior rhinoscopy with Thuticum nasal speculum, you should look at the nasal vestibule by raising the tip of the nose. Next, let's talk about all the therapeutic uses of Thuticum nasal speculum. First of all, we can use it to do nasal packing. You can use this for insertion as well as removal. Then we can also use it while removing foreign body from the nose. We can use for cauterization of any bleeding point, application of medications. Then it is used in a lot of nasal surgeries like SMR or septoplasty or polypectomy. Then this is also used for doing local infiltration. And lastly, this can also be used for antral wash. So these are all the possible uses of Thuticum nasal speculum. Now, how is Thuticum nasal speculum being used when you are performing septoplasty? First of all, before you start the surgery, you can use Thuticum nasal speculum to perform an anterior rhinoscopy and look at the structures there. Then after that, you can use this to give local infiltration to the septal flaps and to the nasal cavity before you start the surgery. So that's how Thuticum nasal speculum is important in septoplasty. Now, a very important question whenever you're giving a Thuticum nasal speculum in your exam is, how do you hold this speculum? This is something that is very confusing for especially undergrad students. You can get very confused. Okay, where should I be facing the blade? How should I hold it? So let's look at the image over here. So what you'll do is, first of all, the speculum is held at the junction of the two prongs, and you will hold it with the help of the index finger as well as the thumb in the left hand. So you have to remember that you will hold it in your left hand, and these blades that you're seeing, these blades should be pointing towards your patient. And this thoticum nasal speculum, these two prongs, they have a very spring action. So you control the spring action with the help of the ring finger as well as the middle finger. So once you close the two blades together like this, and then you introduce the thoticum nasal speculum with its blades closed into the nose, and then gently open it up while you release the spring action with the help of these two fingers. So this is how we will hold the thoticum nasal speculum. Always remember that you're supposed to hold it in your left hand, and the blades should be facing towards the patient. And you will be controlling the spring action with the help of your middle finger and the ring finger. So that's all about thoticum nasal speculum. Next instrument that we have today is the Tilly's nasal dressing forceps. Now, this forceps has, first of all, we have the two ring-shaped finger grip handles over here. Then we have two long, slender blades over here, which have transverse serrations in it. This is important to remember to be able to identify it. So the Tilly's nasal forceps, it has transverse serrations, and this is a flat and straight tip as you can see in the image. And the joint over here that you are able to see, this is the box joint. So this you can see that there is a bend over here in the Tilly's forceps. This bend has been given so as that the hand of the surgeon does not end up obscuring the view of the nasal cavity when the surgeon is using this instrument. So the parts over here are these two ring-shaped finger handles. Then we have two long slender blades which has transverse serrations in it and a flat tip, and there is a box joint. And we have a bend over here. The advantage of the bend is that it will not obscure the view of the nasal cavity. Next, let's talk about what are the different uses of the Tilly's nasal dressing forceps. First of all, we will use it for anterior nasal packing. Now, in what cases will we do anterior nasal packing? We can do it post-operatively if there is hemostasis in a patient. We can do in case of epistaxis if there's an anterior bleed. We can also do it in case of fracture of nasal bone for fixing it. So first use is anterior nasal packing. And second, we can use the Tilly's forceps to introduce cotton pledgets which are soaked in adrenaline for local anesthesia into the nasal cavity. And third, we can also use this to remove foreign body from the nose. So these are the uses of the Tilly's nasal dressing forceps. Now, second thing is this forceps is very commonly confused with another forceps that we have, which is known as the Hartmann's forceps. Now, let's look at the image and see what are the differences between these two forceps and how do we not get confused by them. So on the left, we are seeing is the Tilly's forceps. As I mentioned, the joint in Tilly's forceps is a box joint. Whereas if you look at the right, this is a Hartmann's forceps. The joint over here that you are seeing is a screw joint. So that is one major difference. Second is, let's look at the tip of the instrument. If we look at the tip of the Tilly's forceps, we can see that they are flat surfaces. And as I mentioned before, if this is the surface, they actually have transverse serrations in it. Whereas for Hartmann's forceps, let's look at the image over here, we can see that the jaw is serrated and grooved. So it is grooved like this and it is serrated. So these are the two differences between the Tilly's forceps and the Hartmann's forceps. So whenever you're given this in your exam, you should not get confused. It's very important to remember these two differences. Okay, next let's move on to our next instrument. So now Freer's elevator, let's look at the parts of this instrument first. First of all, we have a long central handle or a shaft. And we have two ends. One of the end is sharp and one of the end is blunt. And we can see this concave bend to the end as well. So these are the parts of Freer's elevator. Now let's talk about what are the uses of this instrument. First of all, our very important use, especially in case of septoplasty, is we use this to elevate the mucoperichondrial or the mucoperiosteal flap in both septoplasty as well as SMR. This is our first use in case of septoplasty. Second, this is also used to do a bony cartilaginous disjunction to separate the septal cartilage from the bony septum. This is one of the steps in septoplasty. So you use Freer's elevator to separate the septal cartilage from its bony attachments. Third, so these are the two uses that we have in case of septoplasty. Other than that, there are also more uses for Freer's elevator. For example, we can use this to displace the inferior turbinate in case of antrostomy operation. We can use this to fracture the inferior turbinate. We can also use this to perform uncinectomy in FES. And lastly, this instrument is also used while harvesting a temporalis fascia graft during the time of meringoplasty or tympanoplasty. So these are all the uses of Freer's elevator, but these two first uses that I mentioned, these are applicable in case of septoplasty. Very important to know is when you're elevating the mucoperiosteal and the mucoperichondrial flap, which surface of the Freer's elevator should be facing which side. So it is important to remember that if this is the curve, so this is the convex side of it, right? This convex side, this is convex smooth side should be facing towards the flap. This is done so as to reduce the chance of any flap tear, the risk of flap tear when you're trying to elevate the mucoperichondrial or mucoperiosteal flaps. We have to be as careful as possible while elevating the flap. This is a very important step in septoplasty. You can to know the steps more in details. I have a separate video on the procedure of septoplasty. You can check it out over there. It is important to remember that we try to prevent tears as much as possible while you're raising the flap. So this is about Freer's elevator. Next, let's move on to Killian's long-bladed self-retaining nasal speculum. So the Killian's long-bladed self-retaining nasal speculum is actually, as you can see over here, has very long blades and it has a self-retaining mechanism, which is why the name is such. So let's first talk about the different parts of it. So first of all, we have the two long blades over here. This is what enters the nasal cavity. Then we have the handle over here. This is used to open and close the blades. Then we have a spring hinge or a plier mechanism over here. Then we have a locking screw with a self-retaining lock. So these are the different parts of the Killian's long-bladed self-retaining nasal speculum. And these blades that you're seeing, these are available in different sizes. And you can adjust the distance between the two blades over here and fix it with the help of this locking screw. So these are the different parts of the Killian's nasal speculum. Next, let's talk about what are the different uses of this speculum. First of all, we have its use in SMR as well as septoplasty. What do we do here? We use the speculum to retract the mucoperiosteum. We retract the flaps away from each other and fix the screw over here to increase our visibility of the area. So this is the purpose of using the speculum in septoplasty. Second, this is also used to do anterior nasal packing. This is the second use that we have during the time of septoplasty. So these were the two uses in septoplasty of this instrument. There are some other uses, like you can use this to remove any nasal foreign body or any rhinolith. You can even use this for doing polypectomy. This can also be used during turbinate reduction surgeries. And lastly, this can also be used to take biopsies. So these are the uses of the Killian's long-bladed self-retaining nasal speculum. Now let's talk about a few advantages of this instrument. Before we talk about that, another thing that I want to mention is the instrument is held over here. These are the two handles, and this is exactly the direction, the upside down direction in which this speculum is usually used. So you hold it over here with these two handles, and this is facing downwards, and this then you introduce these blades inside the nasal cavity, open the blades, and then adjust it with the help of this locking screw. Now the advantages of this instrument is that first of all is because you first of all is that you can adjust the distance between the blades. So that is one important advantage. Second is that it is self-retaining. It has this self-retaining screw, self-retaining lock and a locking screw, which helps you to just lock it in place at the distance exactly that you want, and it will self-retain itself. You do not need to keep holding and pressing on it. Third, because of its long blades, it allows the visualization of deeper structures in the nasal cavity. And lastly, it reduces the chances of any mucosal damage or any kind of septal perforation. So these are some advantages of using this particular nasal speculum. So that's about the Killian's long-bladed nasal speculum. Next, let's talk about the next instrument, which is the Lux forceps. Now, the Lux forceps, as you can see here, if you look at the parts, this is where we hold it. These are the ring handles. Then here we have the screw joint. And we have these two fenestrated sharp-ended blades. So these are the different parts of the Lux forceps. Now, what is the use of Lux forceps? First of all, let's talk about its use in SMR as well as septoplasty. So Lux forceps is used to remove any deviated part of the cartilage or bone that you are removing during the time of the operation. It can also be used to remove the spur. So this is its use during the time of septoplasty. You can easily take out pieces of the bone or the cartilaginous septum that you want to remove to correct the deviated septum. Other than this, there's a lot of other uses, like it can be used in Calvin-Luck operation or even during removal of polyp. You can also use this instrument to do punch biopsy. Next, this can also be a substitute to the tonsil holding forceps, which is used during the time of tonsillectomy. So, this is another one of the uses. This can also be used to perform a turbinectomy. And lastly, you can also use to remove any adenoid tags, which can remain after adenoidectomy. So these are all the different uses of this Lux forceps, and this is a very important instrument in septoplasty because this is what you use to remove any cartilage or bone or even the spur. Now, the advantages of having this Lux forceps is, first of all, because of the way the blades are, it has a very strong grip on very slippery mucosa. And these fenestrated jaws that you're seeing, these are fenestrated jaws over here. These jaws prevent any form of crushing when you're trying to remove any tissue. So what happens is when you hold with the help of these fenestrated jaws, the tissues bulge out through the fenestra in it. Therefore, these tissues do not get crushed. That is one important reason why we use Lux forceps to do punch biopsy. And lastly, the third important advantage is that it is very good for grasping as well as cutting simultaneously. So these are the different uses and the different advantages of using Lux forceps. And the primary use of Lux forceps in septoplasty is to remove any cartilage or bony parts that you're removing from the deviated septum, as well as removal of the spur. Next, let's move on to our next instrument, which is the Killian's nasal gouge. Now, this gouge is a bayonet shaped gouge, which is going to allow you adequate visualization inside the nasal cavity. And this edge that you're seeing over here is V-shaped so as to get a better grip on the bone. Now, this nasal gouge is very commonly used with the mallet or a hammer. Now, the uses of this nasal gouge in case of septoplasty is, first of all, we remove any bony spur in SMR as well as septoplasty, and this is also used to remove the maxillary crest during the time of SMR or septoplasty. Third usage, which is not during septoplasty, is you can even use this to open the bone in the canine fossa in case of antral surgeries or the Calvin-Luck operation. So these are the three uses of the Killian's nasal gouge. This is bayonet shaped. You have to remember that the edge of this is V-shaped, and this V-shaped is such that you get a better grip on the bone, especially when you're removing the maxillary crest. And this bayonet shape, this angle over here that you're seeing, this is so that when you're putting it and you're using the mallet to cut through the maxillary crest, this angle is what is letting the surgeon have adequate visualization of the area that he's working on. So that's about the Killian's nasal gouge. Now, next to this, we'll talk about the mallet. Now, the mallet that we usually use here is known as the Heath's mallet. The parts over here is, first of all, we have the heavy cylindrical striking head. Then we have a neck over here, and we have a handle or a shaft over here. So these are the different parts. Now, what are the uses of it? First of all, we use it along with the Killian's nasal gouge in SMR or septoplasty. And we use it to remove any kind of spur. We remove the maxillary crest as well with the help of this. And we can also remove, or we can also open into the canine fossa during the time of Calvin-Luck operation. And this mallet can also be used along with an osteotome in terms of nasal bone work. So these are the different uses of the Heath's mallet. This is an instrument that we usually use along with a Killian's nasal gouge. Next, moving on to this instrument, which is the Hayman's turbinectomy scissors. Now, Hayman's turbinectomy scissors, as you can see over here, has a nice bend over here. The reason for this bend over here is, again, to give you improved visualization when you're trying to cut anything with the help of these scissors. Your visualization or your field is not obscured because of the scissors. The bend allows you that visualization. And we have over here the blunt tip. You have to remember over here, these scissors have a very blunt tip, and these are the narrow, stout blades that it has. Now, the use of this, as we can tell from the name itself, is we use it to do turbinectomy, especially of the inferior turbinate. And you can even use the scissors to cut a deviated part of the septal cartilage. So if you want to cut off a part of the septal cartilage and remove it, you can use the turbinectomy scissors to do this, because this has a blunt tip. When you introduce the scissors inside, it has less chance of causing any injury to the flaps. So these are the two uses of this scissors. And let's talk about a few advantages of this as well. First of all, as I mentioned already, this angled design over here, this gives you more visualization of the area when you're introducing the scissor. It is not obscuring your view. Second advantage that we have is the blunt tip over here. This reduces the chances of any accidental trauma to the septal flaps. And because we have a very long blade over here, we are also able to reach the posterior end of the turbinate with this. So these are the three different advantages of the Hayman's turbinectomy scissors. This finishes most of the instruments that we needed to know about in terms of septoplasty. Along with this, I wanted to show you a few more instruments that are used, but I'm not going to describe them in details. This is what a nasal suction cannula looks like, and this is usually used to remove the blood, the mucus, or any kind of secretions while you're performing the surgery. To give the incision of septoplasty, we usually use a BP handle along with a 15 number blade. And the incision that we preferably use in septoplasty is the Freer's incision, and in case of SMR is the Killian's incision. If you want to know more about the incisions, I have a separate video on that. You can check it out over there. And then we have the suction elevator over here. Now, if you look at it, nowadays we actually use instead of the Freer's elevator, sometimes we use the suction elevator to elevate the flap, because this actually has a dual function. So not only does this tip is helping you in elevating the flap, if you can see over here, there is a suction over here. This has a dual role of acting not just as an elevator but as a suction tip as well. So this will help you in having a much clearer view of your septal flap region while you're elevating the flap. So it will suction as well as elevate at the same time. And lastly, we have the Merocel nasal pack over here. Merocel nasal pack is used at the end of your septoplasty. We usually insert it and we keep it to give support to the corrected nasal septum that you have just performed. So we usually remove the nasal pack after about 48 hours of surgery. And this is very easy to remove with the help of these threads that are tied at the edge of it. So that's all about the different instruments that we use in septoplasty. If you have any doubt regarding this, please note them down in the comment section and I'll get back to you. Thank you.